Okay, as I said, 14,000 to just under 70,000. Some of the code descriptions are completely different. And so how you look it up in the system to find it may be very different. So whatever product you're using to search might be different. For instance, in PEDS, congenital bow leg deformity is what it's called now, and in ICD-10, it is congenital bowing of the long bones of the leg. I think it's the same thing, the same disease condition, but how it's looked up is different. Post-traumatic stress disorder, not hyphenated in ICD-9, hyphenated in ICD-10. Sounds like a little Manini kind of issue, right? Not if you're looking. If you're trying to search and you're searching like this, you got to know that it's technically spelled differently. So these are the things that are going to take time just getting used to it. And I'm going to show you how to convert ICD-9s to ICD-10s so you can start seeing these differences in the descriptors and start familiarizing yourselves with them now. Some of these descriptions are now 25 to 45 characters longer. So that's what I meant when someone goes to their drop-down list, whether it's in your software or in a physician's software. If you go to a drop-down list and your file was this big and now it's this big, number one, are you going to see all of this? Or is it truncated and you only see this? Hopefully you see the entire 45 character additional descriptor on there to be able to pick that right. Find the appropriate code. Longer searches, more choices, whether or not their EHR system interfaces with the billing system, are they using a standalone product for lookups? I know some of the community health centers use something called IMO, which is a diagnosis code search. So whether they're running NextGen or they're running some other EHR, they use an interfaced product to do diagnosis code lookup. I'm just hoping that that's meshed so when they pick it, it's correct and it actually shows what they chose. The full descriptor, I guess, of it. Okay, I mentioned the 7th character extender. Not every code in ICD-10 will have 7 characters, but many of them do. All of the injury codes will have a 7th character extender. Many of the 7th character extenders are also required in the OBGYN, so maternity, OB, trimesters, so those are required. Many of the musculoskeletal, and I'm going to show you some examples next as to what those look like. But a 7th character is just that. It must always be a 7th character. So a question was asked about a 3-character code. So let's say you have G40, a 3-character, and it requires a 7th. It's only 3. Can you take that 7th and move it down? The answer is no. You must have placeholders in there because 7th must always be 7. This is going to be problematic from a claim perspective because unless the health center's software tells them they've got to have X's in those pukas, their system will probably truncate it and you'll get an invalid code.
Hey Jerry?
Yes.
What's the community standard for populating that placeholder? Is it an X?
It is an X, and here's what it looks like. So osteoporosis, current spine fracture. This is a medical condition now. This is not a traumatic fracture. So this is osteoporosis, age-related pathological fracture. The initial encounter, and we'll talk about that in just a moment. But the initial encounter, so this code was only a 5-character. M80 is age-related osteoporosis. It was M80.08. It requires a 7th because this is the initial encounter for this provider for this condition. But because it was only 5, you have to stick the X in there as a placeholder because your 7th must always be 7th. Laceration, foreign body right hand. So the kid is seen in the emergency room and gets the foreign body taken out and gets sutures put in. They come back a few days later to see the provider for either the wound check, suture removal. It may be a global situation, but superficial lacerations, there's no 10-day on it anymore, so you'll be paying for that follow-up office visit. There's no more injury-related aftercare codes. Right now, you would get a V code for suture removal or a V code for wound check. You'd get something generic that just said they had this injury, they came in now just to get the wound check. That's all you need to know. In ICD-10, there is no more aftercare for injuries. Now, all aftercare services for injuries are coded to the injury. Problem number 3, right? Because how would, I mean, if the same doctor stitched them up in the emergency room and is now seeing them fine, but what if they saw the ER doctor and they billed, and now the pediatrician is seeing them and they're billing? How will they know exactly what that injury was? So communication is going to be real important. In this case, this follow-up visit for this laceration, the subsequent encounter, the 7th character required for this particular scenario is D. So this one was a 6th character, so we don't need a placeholder, but we need this 7th character. Patient comes back 3 years later, they come in and say, you know, I had a burn a few years ago and I don't like this scar, so I want you to look at it. 3rd degree burn, sequela or late effect, or a follow-up type situation. Here's the burn, 3rd degree, chest, placeholder, and the 7th character in this circumstance is an S. So my question always to the providers when I get to this slide is, okay, so you use Epic, or you use Allscripts, or you use eClinicalWorks, or you use NextGen. When you pull up that drop-down list, is it going to just give you this? Or will it give you all the possible combinations like A and D and S? Is it going to give you everything? Well, right now, what I'm hearing from everyone is that the EHRs haven't given them the files yet, which is a little bit of a mystery to me because, I mean, these files are out and about, and why Epic wouldn't just say, here you go, here's your upgraded version, so you can start playing with it, because they all want to start submitting test files to you folks and everybody else, but they have no way to do it because their systems have not been updated yet. I've heard everything from March 29th for all scripts to August, yikes, for Epic, to, I don't know, all kinds of different dates. And I know we tell the health centers, just go ask your vendors. Tell them you want it and you want it the sooner the better. I'm sure they have to pay for it, but you need it the sooner the better so you can start getting familiar with what your system can do. Because if it doesn't tell you this and it only gives you that, it's going to be up to that provider to remember the X and the A. So that's a whole different level of training on my part, right? If I knew that their system was going to give them that, I'm going to say, okay, you're good, because it'll bring it up. You just have to pick the right one. But if it doesn't tell you this and this, I have to teach them how to do that. Yes?
Jerry, sorry, you don't know if the data that they're releasing, the file layout, or the actual data, will actually have that placeholder as an X.
I do not. I've been told that
it could be blank.
it could be
And then it
blank.
could have an A as the 7th character.
Yes. And that's the question. Now, I've been told that Epic is going to include every single possibility for all of these, which just means that they're going to have all 70,000 codes sitting in their system, which is another, a whole other problem, right? Is that we tell the health centers, you need to be asking your vendors right now, are you going to need 2 computer systems? Because you've still got to run ICD-9 for some time, you know, with old stuff. And now you're going to have a whole 70,000 codes loaded in here. Can you print 2 different claim forms? Can you, you know, what are you, anyway. So we're telling them they need to get with their vendors and ask these questions, because it's very different from the way what they will train internally and even for what, you know, we provide.
You know the mapping tool that, you know, the $90 license for mapping tool, how does it do it? Does it show the small x as a placeholder?
It shows all, yes. I'll show you an example, yes, but it gives you all the possibilities.
Okay. But it has an X, it doesn't have just a space.
It has an X.
Okay. Thanks.
Yeah, and even if it's a code that has, you know, 3 X's, if this one was just this code and it had 3 X's here, it shows you all possibilities.
Okay, so we need to make sure that that's, in our data set, that when we load our ICD-10s, that small x is a valid character. for that
Yeah, and right
placeholder.
now, CMS is saying that it can be upper or lower, that it won't be case sensitive.
Okay.
And so that will help a lot if it can all be uppercase, because I don't want to be having also to do shift and X,
Yeah.
and, it's bad enough I have to do alphanumeric, much less remember to shift, so.
Thank you.
Okay, trimesters. Right now, OB codes are coded based on when there's a complication during that global period, the codes are the ICD-9 codes are selected based on at what point during that global pregnancy did that complication take place? Was it an antepartum situation? Did it occur during delivery? Was it a postpartum complication? So really you just have to worry about before, during, and after as far as a fifth digit goes. Well, that's going away. And now most of the codes in this section have a final character which identifies the trimester during which that complication took place. So it's the same concept, just more specific. Instead of antepartum, it will be trimester specific. There are some conditions that if the complication can only occur during one point during that pregnancy, for example, during delivery, maybe a third-degree laceration, tear. If it can only happen during delivery, you won't have all the options, obviously, because it couldn't be ante or post, it will just be. But for many of the codes, let's say it's hemorrhoids, it could be at any point during that before, during, and after, right? So all of those codes will have options for the trimesters. In addition to that, there is something new that's been added for OB coding, and that is the weeks of gestation. There's now a code for the exact weeks of gestation, and here's what it looks like. So here's 091.112, which is abscess of the breast that occurred during pregnancy in the second trimester. All of these codes now require 2. So you should not get this code by itself. It should always come in with the secondary code. So any code that starts with O should come in now with 2 codes. And the doctors, of course, their argument is it's redundant. What difference does it make if she got this breast abscess in 16 weeks or 15 weeks or 18 weeks? I'm going to treat it the same way. I don't know the answer to the question. I just know they have to do it, and that's what I tell them. Second trimester, and then a second code now that is required. This is also required for supervision. So right now your V22.1, your supervision of normal pregnancy, you probably don't get those claims because it's global. You don't get no charge claims. But if you were collecting that data, anything that's going to be now a Z code for supervision of a normal pregnancy also requires this. So we tell the health centers, you can start asking this now. I mean, chances are you know this already now anyway, and you shouldn't have to ask how many weeks pregnant she is. But the MAs, when they check the patient in, just like they do for meaningful use when they're collecting information about their smoking and other circumstances, start documenting in the progress note 16 weeks, 17 weeks, 19 weeks, 22 weeks, whatever it is, then it's already done. But they can start this process now. I mean, not coding it, but collecting that information in the progress note. Yes?
The 7th place extension is both alpha and numeric? It's alphanumeric?
It will
Just
always
alpha?
be numeric. Will always be alpha.
Okay, and for different diagnosis, is it a different, is A different, or B is different?
I wish I could tell you that A is always initial, D is subsequent, and S is sequela, and it is for many of the sections of the injury codes. However, for fractures, the 7th character extender is not only initial, subsequent, sequela, but how is that fracture healing? So you have actually 16 different combinations, 16 choices in the fractures.
But S is always sequelae, or S sometimes is sequelae?
It could be different. If we're talking about a fracture, it can be different.
Okay.
Yeah, I know. I wish that was the case, because I could start memorizing things, but I can't yet. Anyway, yes.
This example here, so that Z code is looked at as kind of like an add-on.
Yes,
Is it a required add-on?
from a coding perspective, yes.
So our systems set up to say that, hey, you put in the first one, but it's not gonna let you go past the second field of putting in the second DX?
I
Would they allow
I-
this method?
think if you get, on the Medicaid, on the MedQuest side, I don't know, because I think you have more flexibility with what you require. On the Medicare side, if this comes in by itself, it should bounce. Because it's
So we have to
looking for
look
this.
See if our system will handle it.
Yeah, because it should, and so CMS will be a whole different animal than on the MedQuest side, because CMS should be following coding guidelines. Now, whether or not you can tweak your system to say, if it's there, great, if it's not, great, I don't know. But good question. Okay, we talked about the placeholders. It is going to always be the letter X. Again, here's that example of the third degree. So it will be placeholder is an X. And again, it's allowing for expansion, right? Because eventually we may have a code that now gets expanded to 6 characters or 7. So the placeholder is simply allowing us for that expansion. Okay, health maintenance. Z23 is the code for any inoculation, immunization, vaccination. So this is one little tiny piece of good news in that right now you're requiring for immunizations, you know, the kid comes in and gets DTaP and polio and Hib and Hep B and chickenpox and half a dozen other things. Patient comes in and you have a CPT code that is unique to the vaccine product, but you also have a diagnosis code that links to that vaccine. Well, in ICD-10, it doesn't matter what shot they get from an immunization perspective now. Flu shot, pneumovax, MMR, DTaP, it doesn't matter, one code, one diagnosis code. So it will be driven by the CPT code that you receive. The Z codes are also for routine exams. So well babies, well womans, pre-ops, routine physicals, that kind of thing. Some of these codes distinguish between a routine examination that was completely normal and a routine examination with findings. And I'll show you an example. There are a bunch of these Z codes that describe even routine eye exams. So anything right now where you get a V code for a routine exam of any kind will become a Z code, and many of those will require additional codes. So here's an example. Adult physical in general adult medical exam, completely normal, no abnormal findings. Right now it's V70.0, routine physical. Z00.00. If there are existing problems that are managed, if there are new problems that are identified, so there is some other condition that is being reported with that routine physical, must also use the additional codes for findings. So along that line with the system requirement, you would never expect to get this by itself, because this means there was something abnormal, and coding guidelines require that provider to tell you what it was. So they come in for a routine physical and they find that they have an ear infection. Routine physical, abnormal finding, code for otitis media or whatever it is. So again, this is one that should never stand alone. Same thing with gynecology exam, and these are just a couple of examples. It's true whether it's eye exams and whatnot. Gynecology exam with abnormal findings. Here's that one is what's saying that there was some kind of abnormal finding. So you would use the abnormal finding code. So let's say breast lump. So Z01.411, add the code for the breast lump. And then if the doctor also did those screenings like chlamydia and PAPs and whatnot, just like they do now, they send you the V72.31, I think it is, for the well woman exam, and they'll give you an additional code for the PAP and an additional code for chlamydia and whatever other screenings they've done. That's how you get your data, right? That's how you know what they did during their EPSDT. That's how you know what they did during their well woman exam. That's how you know that they're meeting those quality measures. So these are important. You will never get this by itself. So maybe what we need to do is isolate those codes that will always have a partner and see what the system can do with that. That might be a good first step. Okay, combination codes. You'll probably like this one because right now, anytime there's a diabetic patient that has manifestations, these don't get coded correctly now anyway in ICD-9. So now this is a little easier way for the providers to report it. And again, a lot of this comes down to the data you're collecting for internal purposes, your chronic disease burden, your chronic conditions that are being managed, your Medicare Advantage, all that data you have to collect for Senior Advantage, Medicare Advantage. Right now, if a patient is a type 2 diabetic with eye problems, let's say retinopathy, the way it's coded is your diabetes, type 2 with ophthalmic manifestations, that's this code right there. Anytime you have this, it requires a secondary code because you can't say this is diabetic with ophthalmic manifestations and not say what that manifestation is, or at least that's the way it's supposed to happen. Right now, my guess is you get this, you maybe sometimes get the retinopathy code, but you usually don't. Depends, and then you'll get the code from the ophthalmologist and you get the retinopathy code for diabetic retinopathy, but you don't get that. So she's chuckling because she knows. And it doesn't get coded properly now anyway, so your data is junk. Sequencing errors are prevalent. In ICD-10, there are a number of codes that have now been added that combine it. So this is good because here's your type 2, mild, non-proliferative retinopathy without macular edema, one code. You got a whole lot of these. There's moderate non-proliferative, there's with and without macular edema, but it's still just one code. So once the providers catch on to that, so now your ophthalmologist can use it, your internist can use it, your endocrinologist can use it, one code. So that's kind of good news, I think. All right, laterality. ICD-10 includes codes for laterality, left, right, and bilateral. Not every chapter, of course, has them, but many of the chapters do, and here's some examples. Swimmer's ear or otitis externa of the left ear, that's your code for otitis externa. These mean something. In this case, 2 is left. Serous otitis media, recurrent, bilateral. In this case, the bilateral is 6. Right now, for a sprained wrist, we have one code for a sprained wrist. That's all we care about, is it's a sprained wrist. Well, in ICD-10, it's drilled down, carpal joint, right wrist, and what encounter? Initial, subsequent sequela. So this go from one code of the sprained wrist to the complicated code. Chances are, if the orthopedic surgeon or the orthopedic doctor is treating this, they will know that it is the sprain of the carpal joint. If the pediatrician is doing it, they just know that it's a sprained wrist, right? So there are unspecified codes for these. We'll talk about unspecified in just a moment. Anyway, I wish I could tell you that the right was always 1, left is 2, and bilateral is 3, because I could remember that. However, as you can see, it's not, because in this category, bilateral is 6. Go figure. Most of the time, or a lot of the time, it is 1, 2, 3, if it's bilateral. So that will help a little bit, but there are a number of sections where it's just kind of all over the place. Okay, unspecified. When I was here in December and spoke with the management folks, we talked about unspecified, and various payers are still in discussion about this as to what to do, how to handle the unspecified. So just know that if you have swimmer's ear of the left ear, my guess is the doctor knows it's the left ear when they're treating it, and they need to report it, treat it and report it, bill it that way. So if you got this code, swimmer's ear, unspecified ear, what are you gonna do with it? I'm not asking for an answer, it's hypothetical. But if you got this code, unspecified, it's probably gonna be a 9 or something. If you got that, what are you gonna do? Because most payers are saying, if a code exists for something more specific, we wanna see it. Why would you ever accept an unspecified ear? I mean, if I was the payer, I wouldn't, but I understand that system-wise, that's easier said than done, right? You can't just go through and eliminate all unspecified, because there are a number of unspecified, I mean, sometimes the doctor won't know. Heart attack. I don't know right now that it was in the right coronary artery. I just know they had a heart attack, so I'm coding acute MI unspecified. I'm the ER doc. So you can't just go through and eliminate all unspecifieds, because you need a bunch of them, a lot of them. Okay, so coding guidelines say you can use unspecified as long as that's the only information you have. But once you have more information and you know that it's the right ear or the left eyeball or the right knee, once you know that, then you must report those codes. That's coding guidelines. So I would think that system-wise, you would want to eventually get to that point as well. So here's a gentleman from Blue Cross of Michigan who said that physicians may be doing a great job with ICD-10. They may be coding properly. However, if they abuse the unspecified codes, if they're submitting acute otitis media unspecified ear, or if they're submitting something like acute myocardial infarction other vessel, other than what, there are codes for those. And they are useful if that's the only information that the doctor has at hand. But once they figure it out, if a code exists for a more specific alternative, they must use it according to Blue Cross. I've heard this from United Healthcare. I've heard this from Aetna. Just a few weeks ago, Aetna came out and said, if a code exists for more specific, we're not accepting. So I'm guessing that they're just saying, if there's codes for left, right, bilateral, don't be sending us an unspecified one because we're not going to process it. That sounds like a lot of internal system work to me to parse those out. I don't know. I'm guessing that folks won't be that sophisticated, at least right off. There are other payers locally that have said, and you know, the folks that I talk to on that level aren't really the decision makers, so it could be just gossip. But folks that are saying, you know, we're just going to take everything at first. We're going to accept everything they send us and just see what we get. Because maybe you'll only get left, right, bilateral. Maybe you won't get junky stuff. So there are folks saying that, you know, it's too complicated to try to figure it out up front. So we're going to accept the claims, see what we get, and figure it out down the road. So.
Hey, Jerry, did you say that usually the 6th digit is a 9 for those unspecified?
Typically an unspecified, it won't necessarily be 6th. It could be 5th, you know, 4th or 5th or 6th, but typically an unspecified will be a 9.